Hi, my name is Sadie Beal, and I'm a Sports Medicine 3 student at South Tahoe High School. For my second project, I made an injury prevention program to help prevent spondylolysis. The patient I worked with is Sarah Goldberg. She's an 11th grader at South Tahoe High School. She's a dancer who's been dancing for 13 years. She does ballet, pointe, tap, jazz, hip-hop, contemporary, and dance team. She has a very active lifestyle, and she experiences back pain sometimes while dancing, but has never had any back injuries. Spondylolysis is a stress fracture of the pars interarticularis of the lumbar vertebrae, which is the small bone that connects two vertebrae. It's one of the most common skeletal injuries in dancers and is caused by repetitive stress due to movements such as bending and twisting. It usually doesn't need surgery, but it takes about 6 to 12 weeks to fully heal. One of the major concerns is that if it's left untreated, it can lead to spondylolisthesis, which is where one of the vertebrae slips out of place and could possibly press on a nerve. One of the best ways to prevent spondylolysis or reduce your chances of getting it is stretching your glute muscles, which helps stabilize the lumbar spine. Another way to prevent it is strengthening and stretching the core and lower back muscles, which also help to stabilize the spine. The specific muscles you should focus on are the multifidus, the transverse abdominis, the pelvic floor, and the diaphragm. It's also important to work on increasing your back flexibility. Creating this program is important because spondylolysis is one of the most common skeletal injuries among dancers. About 40% of male ballet dancers and 25% of female ballet dancers have it at some point. If the nerve becomes compressed, it can lead to nerve damage, which creates serious issues, and it can also cause pain after healing, which affects dancers' careers and lifestyles. The goal of this program is to help Sarah gain more flexibility and strengthen her back, core, and quad muscles in order to reduce the risk of her getting spondylolysis. To give a quick overview of my program, after I did research on spondylolysis and how to prevent it, I created a 2-week spondylolysis prevention program focusing on the back and core muscles. I took the baseline measurement to compare the final result to. Then I had Sarah do the training program 4 days of the week for 2 weeks. And at the end of it, I took the final measurement to compare to the baseline to analyze success. For the baseline measurements, I had Sarah do the sit and reach test, and I calculated the mean measurement of the 5 times she did it. The sit and reach test is a good way to measure the flexibility of the spine. She was able to reach an average of 28 inches. I also had her do as many crunches as she could until she was fatigued to measure her core strength. She was able to do 50 crunches in the baseline. For the first part of the program, she worked on stretching her quad muscles and strengthening her core muscles. She started with the kneeling quad stretch, which stretches the quadriceps femoris muscle group. She did it 1 minute for each leg. Next, she did the lying pigeon progression stretch, which stretches both the quadriceps and the quadratus lumborum, which is the deepest back muscle. It originates from the iliac crest and inserts on the transverse process of lumbar 1 through 5 and the lower part of the 12th rib. She did it for 2 minutes each leg. After that, she did a plank for 2 minutes, which strengthens your spine, rhomboids, trapezius, and abdominal muscles. The last exercise in this part of the program is crunches with her legs raised off the ground. She did 30 reps in 2 sets. Crunches help strengthen your core muscles. The next part of the program was increasing her back flexibility. She started by doing the cobra pose for 2 minutes, which strengthens and stretches her back, and also improves spinal posture, flexibility, and alignment. Next, she did the bow pose for 2 minutes, which improves back flexibility and balance in the core. After that, she did a seated spinal twist for 1 minute on each side, which stretches her core and back muscles. The last stretch she did was a child's pose for 2 minutes, which stretches the obliques, the quadriceps, and the pelvic floor. After she did the program 4 days a week for 2 weeks, we took the final measurements. On the sit-and reach test, the mean length of her reaches increased from 28 inches to 31 inches. On the crunch test, she was able to do 58 crunches compared to 50 in the baseline measurement. Was this program a success? Well, it's hard to determine if an injury prevention program is successful because you don't know when or if a person might get the injury you were trying to prevent. I would say that my program was successful in reducing Sarah's risk of spondylolysis because her reach on the sit and reach test increased from 28 to 31 inches. The number of crunches she was able to do increased from 50 to 58. She says she is having less lower back pain than she did before. The future impact of this program is that Sarah plans on incorporating parts of it into her stretching and warm-up routines.